Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Yellow fever is a serious disease. It affects people in parts of Africa and South America. The disease is caused by a virus. Mosquitoes spread the virus through bites. Yellow fever can be dangerous, but there is a vaccine to prevent it. Recognizing the symptoms and getting early treatment is important. Yellow fever gets its name from one of its most noticeable symptoms, jaundice. Jaundice causes the skin and eyes to turn yellow. This happens because the virus can damage the liver. While not everyone gets seriously ill, yellow fever can be life-threatening. The good news is that yellow fever is preventable. A safe and effective vaccine can protect you from the disease. If you are traveling to an area where yellow fever is present, talk to your doctor about getting vaccinated. Yellow fever is caused by a virus called the yellow fever virus. This virus is spread through the bite of infected mosquitoes. Mosquitoes become infected when they bite an infected person or animal. The infected mosquitoes can then transmit the virus to other people or animals through their bites. There are two main types of yellow fever transmission cycles: sylvatic or jungle and urban. In the sylvatic cycle, the virus circulates among primates in the rainforest. Mosquitoes that bite these infected primates can then transmit the virus to humans who enter the forest. In the urban cycle, the virus is transmitted from person to person through the bite of infected Aedes aegypti mosquitoes. These mosquitoes breed in stagnant water sources commonly found in urban environments, such as tires, flower pots, and water storage containers. Yellow fever symptoms can vary from mild to severe. Some people may experience no symptoms at all, while others may develop life-threatening complications. The incubation period for yellow fever is typically 3 to 6 days, but it can range from 3 to 14 days. The initial symptoms of yellow fever are often sudden and flu-like. They may include fever, chills, headache, muscle aches, fatigue, loss of appetite, nausea, and vomiting. These symptoms typically last for 3 to 4 days. In some cases, the symptoms may resolve at this stage. However, some people experience a more severe toxic phase of the illness. During this phase, the initial symptoms may worsen and new symptoms may develop. These symptoms can include high fever, jaundice, bleeding from the gums, nose, or eyes, abdominal pain, vomiting blood, and decreased urination. Section 4. Diagnosis and treatment. Diagnosing yellow fever can be challenging because its early symptoms are similar to other diseases such as malaria, dengue fever, and leptospirosis. To diagnose yellow fever, doctors consider the patient's medical history, travel history, symptoms, and laboratory test results. Blood tests are essential for confirming a yellow fever diagnosis. These tests can detect the presence of the virus or antibodies produced by the body in response to the infection. A blood sample is usually taken from the patient and sent to a laboratory for analysis. There is no specific antiviral medication to treat yellow fever. Treatment primarily focuses on relieving symptoms and supporting the patient's body functions. This may include providing fluids to prevent dehydration, medications to reduce fever and pain, and oxygen therapy if needed. Section 5. Prevention, your best defense. Preventing yellow fever is crucial, especially if you are traveling to areas where the disease is present. The most effective way to prevent yellow fever is through vaccination. The yellow fever vaccine is safe, effective, and provides long-lasting protection. In addition to vaccination, mosquito control measures are essential in preventing the spread of yellow fever. This includes eliminating mosquito breeding sites by removing stagnant water sources, using mosquito repellents, wearing long-sleeve clothing and pants in mosquito-infested areas, and using mosquito nets while sleeping. Public awareness and education are vital in preventing yellow fever outbreaks. By educating people about the disease, its symptoms, and prevention methods, we can empower individuals to protect themselves and their communities. Remember, prevention is always better than cure when it comes to yellow fever.